Hi, Ms. Morales. How are you today?
I'm good. How are you?
I'm doing well. My name is Phoebe, and I'm going to be your occupational therapist today.
Okay.
Okay, so today I'm going to be doing a couple of tests just to check the movement at your wrist and your hand, your fingers. And I'm also going to be doing a test to check the muscle strength in your wrist and your hand. Okay? So we're going to go ahead and get started. If I can have you bring your elbow to rest on the table and put your hand up straight. I want you to bend your wrist, bringing your hand down and forward, and hold it there for me, okay?
Okay.
Okay, now if I can have you bring your hand back up straight, and I want you to bring your hand up and back and bend your wrist as far as you can, okay? Hold it there for me. Okay, now if I can have you bring your hand flat on the table for me, just like that. Now I want you to move your hand towards your pinky side without moving your elbow, just your wrist, okay? And hold it there for me.
Okay.
Okay, now if I can have you bring your hand back straight, and then I want you to turn it towards your thumb side as far as you can, and I want you to just hold it there for me, okay? Okay, very good, and you can just relax your hand. Okay, Ms. Morales, now if I can have you bring your elbow back up for me, and I want you to bend your hand, but with your fingers straight at the tips, okay? And just hold them there for me. I'm going to bring your arm just a little bit closer. Okay, now I'm going to ask you to bring your elbow back up, and I want you to bend the tips of your finger just like a claw, just like that. Perfect. And bring your elbow just a little bit closer. And if I can have you just hold them there, hold your hand right there. Okay, now go ahead and keep your hand right there. And I'm going to measure this side of your finger, okay? And can you just relax your hands up just like that a little bit for me? There you go, perfect. But flex them as far as you can, okay? Okay, you can go ahead and just relax your hand. What I'm going to ask you to do is bring your hand with the back of your hand flat on the table for me. And I want you to bring all your fingers in and try to touch them to the center of your palm for me. Okay, don't squeeze too hard. Okay, that looks perfect. You can just go ahead and relax your hand. Okay, now I'm going to do the measurements of your thumb. So if I can have you to bring your hand to rest on its side with your palm facing in. I want you just to bend your thumb down for me as far as you can. Okay, and just up right there. And you can bring it out away a little bit to bend it if that makes it easier, away from your palm. Okay. There you go. And just hold it right there for me. Okay, straighten up your palm for me if you can. And just keep your thumb bent. Okay, now if you can keep your hand on its side, and I want you to bring your thumb out together and into your palm, and then I want you to bring it away as far as you can, okay? Sorry. Okay, now if I can have you bring your hand with your palm flat on the table, and I want you to bring your thumb out away from your hand as far as you can. Okay, and you can just relax your hand for me. Okay, Ms. Morales, now if I can go ahead and have you bring your hand with the back of your hand flat on the table for me. Okay, and I'm going to ask you to bring your index finger to your thumb. Okay, and then bring your middle finger to your thumb. Very good. Then bring your ring finger to your thumb. Very good. And then bring your pinky finger to your thumb. Okay, very good. You can just relax. Okay, Ms. Morales, now I'm going to be checking the strength of the muscles in your wrist and your hand. Okay, so if I can have you bring your hand, the back of your hand to rest flat on the table for me. Okay, and I want you to bend your wrist with bring your hand up and lean it towards your thumb side. Okay, very good. And I want you to hold it there and don't let me push your hand down. Okay, very good. Now I want you to keep it flexed, and I want you to lean your hand towards your pinky side. Okay, and hold it there, and don't let me push your hand down. Very good. Okay, you can just relax. Okay. Okay, now I want you to bring your palm flat on the table for me. And I want you to bend your wrist, bringing your hand up away from the table. And I want you to lean it towards your pinky side. Just your wrist, not your arm. Very good. Okay, now I want you to hold it there. And don't let me push it down. Okay, very good. Now I want you to keep it bent, your hand up, and then I want you to lean it towards your thumb side for me. Okay, and then I want you to hold it there, and don't let me push it down. Okay, very good. You can just relax your hand. Okay, now I want you to, I'm going to actually tuck your arm back, and I want you to lean forward and sit up straight for me. Okay. Okay, and I want you to bring your wrist up again and lean it towards your thumb side for me. And I want you to hold it there. And don't let me push it down again, okay? Okay, very good. You can just relax. Okay, now I'm going to bring your, I want you to bring your hand, the back of your hand flat on the table for me. Okay. I'm going to check the strength of your fingers. So I'm going to ask you to flex your index finger right there for me. Okay, very good. And I want you to hold it there and don't let me push it down. Okay. Okay, very good. Now I want you to flex your middle finger the same way. And I want you to hold it there and don't let me push it down. Very good. Now I want you to flex your ring finger for me. I want you to hold it there and don't let me push it down. Very good. Now I want you to do the same with your pinky finger. Go ahead and flex it.
I can't do any more than that. I'm trying.
Okay, that's not a problem. You can go ahead and stop it there. Okay, so now we're going to go ahead and do this hand again. So if I can have you flex your finger Right there. Okay, and go ahead and hold it there and don't let me push it down. Very good. Now go ahead and flex up your middle finger and hold it there and don't let me push it down. Okay. Okay, very good. And I want you to flex up your ring finger and hold it there and don't let me push it down. Okay. Very good. Now go ahead and do your pinky finger as well. And I want you to hold it there and don't let me push it down. Okay. Very good. And then relax. Okay, Ms. Morales, now if I can go ahead and have you rest the back of your hand on the table. Okay, I'm going to secure your hand right there. Would you go ahead and bring all of your fingers up for me? And I want you to hold them all there and don't let me push them down, okay? Okay, very good. You can relax. Now with your palm down, I want you to bring your hand up and make your fingers into a claw-like form, okay? And I want you to hold them there and don't let me push them down, okay? Very good, you can relax. Okay, now I want you to make your hand into a longhorn sign for me, if you can. And I want you to hold your fingers there and don't let me push them down. Hold them tight. Okay, very good. You can relax. Okay, now if I can go ahead and have you rest your palm on the table. And I want you to bring your pinky finger away from your hand for me. And I want you to hold it there and don't let me push it in. Okay, very good. Now bring your ring finger away. And I want you to hold it there and don't let me push it in. Very good. Now bring your middle finger away and hold it there and don't let me push it in. Now I want you to bring your middle finger back over to the other side. Okay, and I want you to hold it there and don't let me push it in. And bring your index finger away. Your index finger. Bring it away from your hand. Okay, very good. And hold it there and don't let me push it in. Okay, now if I can go ahead and have you bring your palm up. And have your palm facing me. Okay. And I want you to hold your fingers together. Okay, and hold your middle finger and your index finger together. And don't let me pull them apart. Okay, very good. Now hold your middle finger and your ring finger together. And don't let me pull them apart. Okay, very good. Now hold your ring finger and your pinky finger together. And don't let me pull them apart. Okay, very good. You can just relax your hand. Okay, I'm going to turn your hand back over with the back of your hand flat on the table. And I want you to bring your pinky finger up for me. Flex it for me and hold it there and don't let me pull it, push it down. Okay, very good. Just relax. And I want you to turn your hand back over. And I want you to make the longhorn symbol for me one more time. And I want you to hold your pinky finger there and don't let me push it down, okay? Okay, Ms. Morales, now if I can go ahead and have you rest the palm of your hand on the table. Okay, and I want you to bring your pinky and your thumb together. And I want you to hold them there and don't let me pull your pinky away. Okay, very good. Now I want you to go and bring your palm down and move your pinky out to the side. And I want you to hold it there and don't let me push it in. Okay, very good. You can relax. Okay, now I want you to bring your hand onto its side. I want you to flex your thumb down for me. Okay. And I want you to hold it there and don't let me pull your thumb up. Okay, very good. And I want you to flex your thumb again for me and hold it there and don't let me pull it up. Okay, very good. And keep your hand like that, but you can relax your thumb. Okay, now I want you to go ahead and have your hand on the side again, and I want you to bring your thumb back and just stretch it out as far as you can. I want you to hold it there and don't let me push it down. Very good. Now hold it there and don't let me push it down. Okay, very good. You can just relax your hand. Okay, now I want you to go ahead and bring your hand up in the air. I want you to have your palm facing you, and I want you to hold your thumb to the side of your hand and don't let me pull it away from your finger, okay? Okay, very good. Okay, now I want you to go ahead and bring your hand onto its side. Bring your thumb into your hand. And I want you to pull it away from your hand. Very good. I want you to hold it there and don't let me push it in.
Okay.
Okay, very good. I want you to put the palm of your hand flat on the table. And I want you to bring your thumb away from your hand. Very good. And I want you to hold it there and don't let me push it in. Very good. And I want you to bring your hand to rest, the back of your hand to rest on the table, and touch your pinky and your thumb together. Okay, very good. And I want you to hold your thumb to your pinky and don't let me pull it away. Okay, very good. You can just relax your hand. Okay, Mr. Morales, now I'm going to go ahead and feel some of your muscles as I'm checking them to make sure that everything is working, okay? So I'm going to go ahead and have you bring your hand to your side just like that. Very good. Okay, now I want you to go ahead and flex your wrist for me. Bring it in. Okay, now I want you to hold it there. And don't let me push it back. Okay, very good. And I want you to go ahead and flex your wrist for me again. Go ahead and bring it in. Okay, very good. Now hold it there and don't let me push it out. Very good. I want you to go ahead and bring your wrist back for me. Very good. And I want you to hold it there and don't let me push it in. Okay, very good. And now I want you to go ahead and bring your wrist back for me one more time. And I want you to hold it there and don't let me push it in.
Okay.
Okay, very good. You can just go ahead and relax your hand. Okay, Ms. Morales, based on your range of motion measurements and your muscle testing scores, looks like you fall within normal range on everything.
Okay.
I did notice that your pinky muscle was a little weak, or it might even be missing, but that's a very common thing. As far as if it's just weak, that's something that we can work on in therapy, okay? So
Okay.
thank you so much for coming in today.
Thank you.